It began in rural Guinea in the last days of 2013. The Ebola virus then raged through Guinea, Liberia, and Sierra Leone. It made forays into Nigeria and Mali, killing doctors and caregivers, and more than a third of those infected with the virus. In its wake, Ebola left behind thousands of orphans. Never before was there an Ebola epidemic like this one. Dr. Tom Kenyon heads the Center for Global Health at the Centers for Disease Control and Prevention, the CDC. He says outbreaks in other parts of Africa have been much more easily contained.
The local public knows it's Ebola and takes measures to stop it. They stop touching sick people. They stop touching dead bodies and bury them safely. They wash their hands and with bleach solutions and don't touch one another. That will stop the outbreak.
But in West Africa, even doctors were caught off guard. Dr. Leisha Nolan is a disease detective at the CDC. She says wars left people fearful of outsiders and unwilling to work with them or to change practices that spread the disease.
There's lots of belief that it's a curse, that a witch came and caused these things to happen to people.
Unlike the remote areas of Central Africa, in West Africa, people travel freely between countries and from rural areas to populated cities. It makes the virus hard to contain.
So movement is actually a big problem in this outbreak, and that people continue to move and continue to expose new populations to the infection.
In June, Doctors Without Borders warned the Ebola epidemic was out of control. In August, the World Health Organization called it an international public health emergency. Aid finally started arriving. The U.S. military sent nearly 3,000 troops to build treatment centers in Liberia. Other countries and organizations, even individuals, also sent aid. By mid-December, WHO Chief Dr. Margaret Chan said there were signs of hope in some areas, as well as new outbreaks in others, especially in Sierra Leone.
We must maintain our vigilance. Complacency would be our enemy, and in order to get it to zero, we have been successful in bending the curve a bit, but we need to continue to do more to get to zero.
Despite fast-tracking potential Ebola treatments and vaccines, early treatment and basic care remain the best hope for survival. Carol Pearson, VOA News, Washington.